Do you want to just quickly introduce yourselves as you settle in?
Sure, my name is Katie Lanta, and I'm with the State Education Agency. I'm the Physical Education and Physical Activity Specialist.
And I'm Katie Raywald. I'm the Manager of Park Partners and Community Engagement at DC Department of Parks and Recreation.
And I'm Sharia Shanklin, the Acting Director of the DC Department of Parks and Recreation.
Hello there, I'm Natasha Herring, the Out of School Time Programs Manager with the DC Department of Parks and Recreation.
Okay, we are representing DC and a number of government agencies and community-based organizations. The District of Columbia abounds with 7,821 acres of parks, playgrounds, and green spaces, ranking us in the top 3 cities for green space in America. Yet, childhood obesity is one of our top health issues, especially among low-income communities of color. We aim to tackle childhood obesity by providing easy access to fun, free activities to get families to play their way to health every day. Take a look.
Man, what have we here? Hello, I'm Dr. Moo. Welcome to my office. What's the matter with poor Sharia?
She is just, I don't know, maybe it's the flu. She's always sluggish. It's impossible to get her out of the bed in the morning. I come home, she's just sitting on the couch, eating chips. I couldn't even get her to go to the movies with me this weekend.
No, I think I have a preliminary diagnosis, but I'm going to take a closer look. I don't see no fever. Is your throat sore? I don't see any spots. I think I know what she suffers from. Dun, dun, dun. She suffers from PDD.
PDD?
Play deficit disorder. But you know what? I have an easy remedy for it. In fact, I'm going to give you a prescription.
Oh, no, I don't want to, I don't like take my
Trust me, I'm a doctor. Trust me.
I'm not comfortable with extra medication.
Trust me, take that, take it to your local park. Do you know that in DC, we have at least 2 acres of park space for every resident within 2 miles of their home? Do you know that we can get there by bike trail, we can get there by walking? So I'm gonna give you this as well. Here's a list of all the Playful DC things that you can find. They're free, they're easy to get to, they're right in your neighborhood. On the second page of that, you'll find a map. That map will tell you where all the bike trails are. It'll tell you where all of the walking trails are. You can hop on one of those and be there in no time flat. Trust me. Why? Because I'm a doctor.
This one's right by our house. And it's just around the corner from the grocery store. Come on, I gotta pick up stuff for dinner and lunches anyway. Come on, let's go. Let's give it a try.
It'll be fun, Sharia. Trust me. Come back in a week, you'll be a different reward. I promise.
Come on, we're here. Go play. Come on.
Hey, how are you? I'm Natasha. Oh, look at that, Mom. Are you on our new Playful DC app?
Well, I was trying to check in. Yeah.
Check that out. And look, you have a prescription from
prescription.
Dr. Moo. I know her. She's my sister. I recognize her handwriting. I do it automatically. That's awesome. So why don't you and your daughter come over and play with us? Continue to check the Playful DC app. Every time you log in, you'll earn badges for discounts at local retailers and be entered for prizes. How awesome is that?
That's pretty awesome. What are they doing over there?
It looks like we should join in on the fun and learn how to play the healthy way. So in DC, we try to make sure everybody can play your way to health every day.
Thank you, DC, for such a thoughtful and fun presentation. I think at the heart of your idea, the fact that you're thinking about why don't people use the amazing green spaces and public parks that you have, and what might you do to actually increase access, and actually thinking about equity in terms of the people who may not think about, or might not even know where these public parks are. I think that idea that you have is wonderful. So I'm going to turn it over to the experts here to see if they have any initial reactions or feedback for you. And maybe I was going to pick on Stockton just because he's a DC resident. I don't know if anyone else in the group actually lives in DC
Probably
too.
have a few. Great presentation. Great to see the district represented here. It sounds like technology is part of your strategy. Can you say a little more about that?
There's a couple of things here. One, we haven't really gotten very far with that. It's just kind of an idea. You know, one of the problems that we were thinking about in all of this is how do we figure out if this is actually effective? How do we track whether or not people are actually responding to our efforts? There are a lot of initiatives in DC right now with the Healthy Schools Act, the DC Sustainability, the Healthy Tots Act. So there's all these efforts that are already happening that should impact obesity. And what we want to do is knit them together instead of doing a whole bunch of new stuff. You know, we want to knit them together so that the 10-year master plan that DC Parks and Rec has just put together fits in with the DC Healthy Schools Act, fits in with the DC Sustainability Plan, and so that all these efforts that are already happening really focus on this issue. But we thought, well, how are we going to know if that's happening? And so, you know, the evidence shows that even in where one might think there is a bigger digital divide, that most people do have smartphones now and access to smartphones. And that you know, things like Twitter and Facebook and social media are heavily used by all aspects of our community. So we kind of thought that might be a way to get people to engage with us, that we could sort of track some numbers without saying, you know, hey, bring your kid to weigh in every week at the park and we'll take your name and your social security number down and make it really awkward and embarrassing for you.
So I would come to you as a doctor, Natasha. It's a great presentation. I just wanted to say that we actually, from the American, I'll just tell you what we're doing. We actually do have prescriptions that we give out to talk about the play and to talk about being healthy and to talk about those. So I think I would bet, maybe we got that from you, but I think that we did. But we're really looking at that and how we can actually link that to that. The other thing that you're talking about, I love all that you're doing from a school perspective. There are other groups that are doing that same thing. I hate to keep going back, but with Head Start, they have a great initiative called I Am Moving, I'm Learning. IMIL, you may know that. And so linking to those kind of things are great. And then the last thing is that you're talking about the innovations. We're really looking at texting. So we have Text for Baby, Text for Kids, and we know that that is one way to really, in a positive way, get to families.
So we're going to take 2 more comments, and one from Dr. Lee, and then closing out the session with Ryan.
Hi, great presentation, thanks. I was going to say three thoughts, I think. One is around data and, evaluations. I was looking at your list of partners, and I'm wondering if maybe it might be good to reach out to the health department, to some of your academic groups that can help you do some of those evaluations. Also, they might already be involved in surveys. I'm not sure if DC is part of the SMART BRFSS list of cities, but if they are already doing sort of routine surveys, like you have a risk factor surveillance system, there's metropolitan area surveys that are being done that are funded by CDC. And so not all cities are a part of that, but if DC is part of that, it'll probably be done through the health department. There are ways to, potentially if surveys are already being conducted, to add questions, or modules to those surveys. And data on obesity can already be collected anyways, right? So there may be ways to design just further studies to enhance what's being done. The other is, when you're thinking about technologies, also thinking about GIS technology as part of thinking about mapping, for example, programs and schools and basically programs and organizations that might tap into the use of these available resources, right? The other piece, of course, is this 2 miles has come up twice now, right? We had the first group talk about that as well. 2 miles is it's a decent distance for bikeability. It is actually, if you look at the studies for walkability, it is probably too far for people to want to routinely walk to, because usually it's a 5 to 10 minute walk that most people are willing to make, and that translates to quarter to a half a mile. 2 things with respect to that. One is what's being done around bicycling connections for both adults and children to these facilities, and how do you talk to, for example, your Department of Transportation and planning to incorporate those connectivity elements in. The other around walkability might be to think about how we break up, and this pertains to the first group too, how we think about breaking up the route to the parks that are 2 miles away, let's say from residential areas, with half a mile, other half a mile facilities or activities that, you know, people are willing to walk to. Then maybe they can walk another half a mile after some rest and play another half a mile, right? So thinking through, I've never actually thought of it that way, but since this 2 miles kept coming up, it's a little bit far for walkability. So thinking about how you might break up that chunk of connectivity in half-mile half-mile sort of intersections might be an idea.
I do want to mention that we have a lot of inventory in District Columbia Parks and Recreation. As you know, NPS is there as well. So in actuality, we do have a lot of playability, very accessible to our communities within our half mile.
Brian?
Great presentation, and I appreciate taking advantage of an existing resource. DC has great parks, but their use, as you note, varies considerably across the city. And I think a nice ancillary benefit of this approach is, of course, it contributes to the reality or perception of public safety and the engagement of folks in their communities. So just 2 suggestions. Beyond the technology piece, it'd be great to hear other ways that you're engaging parents who are often busy and many times working during the day or working multiple shifts. So have you thought about other ways to engage parents or caregivers, even doing, say, some programming at night and other times when folks can use them? And then secondly, how much are you engaging community residents in the actual programming of the activities?
So I'm going to have you hold if you actually had some responses to that, hold them for Ryan afterwards, or then share those thoughts with other folks who meet in the team, because we're going to switch over to the next team. So a round of applause for the DC team.